Patellar tendonitis often occurs in field sports, which are associated with frequent changes of direction. Examples include football or tennis. Sports involving jumping also tend to cause these sorts of injuries. Basketball or athletic events such as long jump and high jump are also sports worth mentioning. And last but not least, popular sports such as running and cycling, as these also put strain on the patellar tendon. The patellar tendon that we see here is essentially the extension of the thigh muscle which connects to the base of the patella, and the patellar tendon extends down from the top of the patella to the shin bone. The pain occurs directly where the tendon starts at the top of the patella. Bending in the knee joint is accompanied by a high tensile load in the area of the tendon, and the deeper you bend and the greater the force exerted during jumps and direction changes, the more tensile load there will be. If this tensile load does not agree with the tendon attachment, it will lead to overburdening of this region. Patellar tendonitis is easy to diagnose. There is a typical pressure pain where the tendon connects to the top of the patella. Ultrasound is typically used to assess the tendon more precisely and detect changes or the formation of new vessels, so-called neovascularization. Assessment of bony structures can be carried out particularly well using magnetic resonance imaging. During an acute phase, a temporary break from athletic training has proven to be effective. In addition, cooling and pain relief through the use of ointments and tablets also helps. Physiotherapy is important in order to make the knee joint more resilient in the long term, so that these complaints no longer occur. Strength exercises and stretching exercises are used for this and, above all, coordination training, i.e., the interaction of muscles and joints. In many cases, a so-called decline board is used for these exercises, which provides a training to stimulate the patellar tendon and to achieve better fiber alignment and regeneration of the tendon tissue. Orthopedic insoles have proven very effective for foot deformities, as the position of the foot also influences the position of the knee joint, which can subject the tendon to a great deal of stress. In some other cases, bandages are useful aids for reducing pain through compression and providing better guidance in the area of the knee joint and patellar tendon. In addition, there is a tension strap that can be placed over the patellar tendon to change the direction of force applied to the patellar tendon at the top of the kneecap and thus achieve pain relief.